This session will discuss evidence-based research and quality outcomes, and we will discuss translating that research into practice. By the end of the discussion of this part of the lecture, you will be able to apply quality management principles to clinical situations, explain how quality improvement affects the patient and the organization, analyze the differences among research and utilization, evidence-based practice, and practice-based evidence, assess organizational barriers to and facilitators of the implementation of research findings, and discuss the use of outcomes research in evidence-based practice. This slide illustrates factors influencing the use of research. One societal factor, rising costs of healthcare, is addressed through the population. The 65 and older population jumped 15.1% between 2000 and 2010, compared with a 9.7% increase for the total U.S. population. People aged 65 and older now make up 13% of the total population, compared with 12.4% in 2000 and 4.1% in 1900. About 44 million people in this country have no health insurance, and another 38 million have inadequate health insurance. In 2013, U.S. healthcare spending in this country increased 3.6% to reach $2.9 trillion, or $9,255 per person. Healthcare costs as a percentage of the gross domestic product were 15.3%. Employee-sponsored health insurance has risen at a rate 5 times higher or faster than wages. Another societal factor is quality improvement initiatives. There are 30 measures that healthcare organizations can take to improve quality. Some of these can be found in the National Quality Forum. Other agencies include the Agency on Healthcare Research and Quality, National Database of Nursing Quality Indicators, the Unit-Based Repository of Quality Indicators designed to assist hospitals to make improvement qualities, and the American Nurses Credentialing Center, which is a magnet recognition program. There's also societal factors and pressures to avoid errors, and you can review these in the Institute of Medicine reports to Errors Human and the Work Environment for Nurses and Patient Safety, as well as the Institute of Safe Medication Practices are all examples of avoiding errors. And then there are research about the cost of not implementing evidence. And this can be seen in nosocomial infections such as catheter-related infections and ventilator-associated pneumonia, as well as pressure ulcers. Other societal factors that influence the use of research is publicity about research findings. An example of these are the accurate measurement of height in primary care practitioners' offices, the fatigue and length of shift work, and the family presence in the ICU. The importance of research is twofold. It's doing the right things to achieve positive patient outcomes. For example, protocols to reduce ventilator-associated pneumonia in critical care units. And number 2, preventing harm by discontinuing outdated or outmoded practices. For example, we no longer use heparin to maintain patency of a peripheral IV catheter. The key elements of the National Institute of Health Roadmap for Reengineering the Clinical Research Enterprise and Harness Scientific Discovery for Health Promotion include the following elements. There are new pathways to discovery, so new strategies for diagnosing, treating, and preventing disease. There's research teams of the future which focus on high-risk research, interdisciplinary teams, and public-private partnerships, and re-engineering the clinical research enterprise, which includes clinical research networks, policy analysis and coordination, dynamic assessment of patient-reported chronic disease outcomes, translational research. The goal is to get research into the hands of practitioners to improve patient care. To this end, the NIH, or National Institute of Health, has announced Clinical and Translational Science Institutional Awards to facilitate interdisciplinary collaboration and encourage scientists to work together to address complex problems. Research is the foundation for practice improvement. Exemplars of research where nurses have made considerable progress in the improvement of nursing practice are preoperative teaching, pain management, assessment of children's behavior, fall prevention, incontinence care, and family-centered care in the intensive care. Those are examples of research done to improve practice. This slide illustrates key points about the application of research to practice. The National Institute of Health Roadmap is designed to facilitate the translation of research into practice. Some decisions should not be based upon the results of quantitative data alone, but need to be integrated with data from qualitative research in order to apply it to a particular practice situation. The quality of care and the quality of the outcomes of care can be dramatically improved through the implementation of evidence-based practice. Requirements for the development of an evidence-based practice include a clearly written clinical question, more thorough search of literature, review of single studies, meta-analyses, critically appraised topics, systematic reviews, and/or clinical guidelines, appraising the evidence, placing evidence in the context of patient, family, and community values. Key concepts for facilitating evidence-based nursing are research utilization, evidence-based practice, diffusion of innovations, translation of research into practice, evaluating evidence, organizational strategies for translation of research into practice, issues for nurse leaders and managers. Appraisal tools exist for evaluating different types of evidence from a single qualitative study, qualitative metasynthesis, descriptive studies, and randomized clinical trials to systematic reviews. Appraisal tools generally include steps for evaluating the quality of the research that is specific to the study design, type of review, or guidelines, assessment of the reliability and validity of the evidence, and a strategy for determining the applicability of evidence into one's own practice. Research utilization is an approach that involves reading the research and then re-examining it for its applicability to practice. Nurses have been leaders in research utilization with a number of early projects. In the definition of evidence-based practice, a key point is the distinction from research utilization, which focuses on using a particular research finding in practice, whereas in evidence-based practice, the focus is solving the clinical problem with research-based solutions. A second key point to emphasize is that evidence-based practice includes consideration of patient preferences. It should be noted that when patient preferences are discussed, it is often in the context of making choices about specific treatment. So many times in certain settings, nurses would assume that patients want to receive the best care possible. For example, with ventilator-associated pneumonia, it would be assumed that the patient preference is to receive the standard of care that would prevent this serious complication. Government and private agencies are placing increasing emphasis on translation science. For example, the Agency on Healthcare Research and Quality, the National Institute for Health Roadmap, the Leapfrog Group, a group consisting of organizations that buy healthcare to foster the implementation of initiatives that are designed to improve healthcare safety and quality. Translation science is an emerging field. Nurses have done work in this arena, but is an area that is just starting to get the attention of funding. The steps of evidence-based practice are outlined in the next several slides. These steps include asking the relevant clinical question, searching for the best evidence, critically appraising evidence, integrating evidence with clinical expertise, patient preferences, and values in making a practice decision or change, and finally, evaluating the practice or decision or change. The first step in evidence-based practice, which is asking the right question, is developing a question in the PICO format. This format includes the patient population, the intervention or interest area, comparison, and outcome. The stages of Rogers' diffusion of innovation theory from 2003 describes how innovation spread throughout society. Diffusion theory is a theory about communication. Subsequently, the theory was adopted and used in other disciplines. It provides a useful model in planning for integration of evidence into practice over time. According to Rogers, the diffusion of innovations occurs in stages: knowledge, persuasion, decision, implementation, and confirmation. The first stage in Rogers' theory of diffusion of innovations is the knowledge stage. Do you subscribe to a nursing research journal? Do you subscribe to a clinical practice journal that has a research column? Think about an example of a research finding that you have read about recently that has important implications for practice. Think about or reflect on how you acquire new information or knowledge. The persuasion stage asks, how do you use informal communication networks in your work or clinical setting environment? Can you identify someone who has served as a champion for an implementation of a key change? What are the characteristics of a champion? In the decision stage, key questions to ask include, what are the factors that would facilitate the adoption of an innovation? What are the factors that would make it difficult to adopt an innovation? And can you think of an example of when an innovation was tried but rejected or accepted? Research can be implemented in a variety of manners. Some questions that are raised when research is implemented include, will the outcomes remain the same if the intervention is modified to suit the particular environment? For example, if a strategy has been demonstrated to be effective in reducing cognitive decline in the elderly during hospitalization, will the same results be achieved if modifications occur? When might the modifications be so extensive that one cannot be sure that the outcomes will be the same? Will data be collected regarding the outcomes? What outcome data should be collected? What happens when there are different recommendations from different guidelines? In the confirmation stage, think about what factors might influence whether an agency continues with the implementation of an innovation. What would motivate the staff to continue with the innovation? What kind of reinforcement for an innovation would work best on your clinical unit? How should the innovation be evaluated? By patient perspective, nurse perspective, or by outcomes? What is the value placed on each of these perspectives? This slide illustrates Rogers' characterization of innovation adopters. Innovators are active in seeking new information. They are the organization's visionaries. Early adopters are the organization's opinion leaders who learn about an innovation and apply it in their practice. They can be effective in communicating the value of an innovation. The early majority won't bring forth an innovation, but will readily adopt it when brought forth by others. The late majority are skeptics who don't adopt something unless there is pressure, maybe be part of a backlash. And laggards are most secure in holding on to the past. They are most comfortable when they know an idea cannot fail. This slide illustrates the steps of Stetler's research utilization model, which has been updated to facilitate evidence-based practice in 5 phases: preparation, validation, evaluation, decision-making, translation, application, and evaluation. Stetler's model provides direction for individuals and members of groups. Thus, it can be readily applied by nurse managers to the clinical setting. This model can be compared and contrasted to the steps of both the scientific method and the nursing process. The steps of the preparation phase, phase 1, includes identifying and defining the problem. For example, using the case management focus by identifying the most common types of clinical problems on the unit, or clinical problems that have been very challenging for the staff. Preparation also involves searching for evidence. For example, using case management focus and finding the most common types of clinical problems in the unit or clinical problems that are most challenging for the staff. Preparation also involves searching for sources of evidence by identifying resources within a clinical agency or community. Resources like librarian at a clinical agency, a librarian at a university. Research priorities as identified by professional groups such as specialty associations, and review sources of evidence such as federal guidelines, clearinghouse. Also, define the external factors influencing innovation adoption. Factors may include accrediting organizations, professional associations, specialty organizations, and third-party payers. Define the internal factors of influence on adoption, such as patient population, nursing staff members, nursing leadership, members of the interdisciplinary health team, board members of an agency, and financial resources. The validation phase uses a rating system for the quality of the evidence. It places information about a research problem in a table that facilitates analyzing and comparing results and the discernment of patterns. Phase 3, the evaluation or decision-making phase, uses resources needed to evaluate the research data, such as faculty and graduate nursing students. This would be particularly important for institutions with limited resources. One might also utilize the research department of a large medical center. Evaluating other factors such as risk, would there be any harm to patients with implementing the practice? Is there any harm from not implementing the practice? For example, testing gastric pH for a nasogastric tube placement. Feasibility. Are there any training or equipment costs associated with implementation? And finally, readiness of the finding. Is this a finding that is ready for implementation? Are there any potential consequences related to implementing this finding? For example, how would parents be trained to safely handle their premature infants for kangaroo care? When translating research studies into practice, consider individual groups, departments, organizations. Consider the use of multiple strategies and use caution in evaluating the strength of the evidence. Evaluation may be done in a formal or informal manner. Stetler emphasizes that evaluation is a dynamic process. The evaluation should include an examination of the outcome as well as the change processes. Evaluation can be done informally, and the information gathered can be used to address problems with implementation and effectiveness. Evaluation can be done formally or linked to patient outcomes. For example, a questionnaire about the change process can be distributed to staff members. An agreed-upon method of evaluation can be used to determine whether the practice change made an impact on patient outcomes. Increasingly, institutions are examining costs associated with implementing a change. Strategies can be used to determine the cost to the institution or any cost savings. It should be noted that there are a variety of methods for evaluating costs, and care should be taken to use a method that is appropriate for the particular situation, and one that captures all of the costs. Evaluation can be done at the individual level or at the institutional level. For example, are individual nurses adhering to a protocol to prevent ventilator-associated pneumonia? At the institutional level, the question would be, has the rate of ventilator-associated pneumonia decreased since the implementation of the evidence-based protocol. A number of leaders in evidence-based practice have developed hierarchies of evidence to assist a practitioner in determining the strength of the evidence. At the lowest rung of the pre-processed evidence is a simple study. However, a well-designed single study with an appropriate sampling may provide evidence for implementation. Individual strategies for promoting evidence-based practice in nursing may include identifying challenges in providing care, asking questions about agency practices, asking for evidence underlying practices, and identifying clinical practice problems. Joining a professional association to have ready access to the latest information about practice problems and trends in nursing is important. And subscribing to journals with research synopsis or signing up for literature review alerts is another way for promoting evidence-based practice in nursing. This slide illustrates strategies for implementing evidence-based practice at the organizational level. In regard to signing up for alerts, here are some possibilities. The American Nurses Association, the Insider includes pertinent news on breaking events of importance to nurses. The Institute of Safe Medication Practices is a newsletter for nurses on medication safety issues. And the Agency on Healthcare Research, Quality and Research focuses on helping people make more informed decisions and improving the quality care of healthcare services. Cooperation in evidence-based practice is necessary to implement evidence-based practice. Therefore, key stakeholders should be identified, and this is done using the PICO question developed earlier to help focus the discussion in this arena. Involve as many people as possible in the process. Think about how many people can be involved. What are the different roles that can be assumed by staff members, students, faculty, organizational leaders, and informal leaders? Partner with researchers, identify researchers and their expertise, describe existing partnerships and future possibilities, partner with faculty and nursing students to gather evidence, publicize your nursing research, publicize your successes. What are organizational strategies that can be used to publicize your successes? For example, have nurses made significant contributions to patient care? What kind of preparation would nurses need in order to feel comfortable about publicizing their success related to practice improvement? And are nurses identified by name and accomplishments in the media within your local community?